joining us today. Our speaker, our wonderful speaker, is Torshie Schandorf from Ghana, joining us from Ghana. Mercy will share with us her experience in establishing a diagnostic center of excellence, a recent experience with IAEA QUADRIL, and I'm keen to learn from her what that is in a bit. Like always, the speaker will have the first 45 minutes or so to present to us, and then we'll leave the last 5 minutes or 5 minutes towards the end for questions and answers. Please post your questions in the chat box, right, or the Q&A, and then we'll end up with final comments and thank you. Mercy will send us some multiple choice questions that we will share with you all after the webinar. And then after you respond, not directly after you respond, after many people respond, enough number of people, probably a week or two, then we will send you certificates of attendance. So we thank you all for your patience. Now we get to our speaker. Mercy is a clinical medical physicist and lead medical physicist at the University of Ghana Medical Center in Greater Accra, Ghana. She holds an MPhil in medical physics from the University of Ghana and a bachelor's of science in biomedical physics from the Kwame and Nkrumah University of Science and Technology. A certified clinical medical physicist through the Allied Health Professions Council of Ghana she is, and she completed her 2 years of residency/internship training at Komfo Anokye Teaching Hospital in both radiation therapy and diagnostic medical physics. Since joining the University of Ghana Medical Center in 2024, Mercy has led QA and quality control programs for MRI, CT, and angiography while advancing radiation safety and dose optimization. She served as medical physics lead for Africa's first IAEA QUADRIL audit in 2025, establishing sustainable framework for diagnostic excellence. She's actively engaged in global collaboration, mentorship, and STEM advocacy, focusing on equitable healthcare in sub-Saharan Africa. And I know that from outside of this webinar. She's awesome. So again, please post your questions in the chat box, and they will be brought forward to the speaker by us, RG and I, to be answered during the Q&A session. Now, without further ado, I give the mic to Mercy and she can share her screen, and I look forward to this presentation. Thank you all.
Hello, can you please hear me? Hello, can you hear me?
We can. Yes, we can.
Okay, and you can see my screen clearly?
We can see your screen very clearly.
Okay, good. Thank you.
Beautiful center, beautiful building, by the way.
Thank you. Okay. Good morning, good afternoon, good evening, everyone. First, I'd like to say a very big thank you to the Medical Physics for World Benefits for this opportunity to share my experience. My name is Mercy Torshie Schandorf, and I am the lead medical physicist at the University of Ghana Medical Center. And today I want to take you through a journey, how we pursue diagnostic excellence, what it's really meant to host the very first IAEA QUADRIL audit in Africa. So for today, I'm looking to introduce you to UGMC, what kind of institution it is and what it stands for. When we talk about the Diagnostic Center of Excellence, what do we define it as? What's the QUADRIL framework is about, and also share our lived experience undergoing this audit. And finally, I'd like to close with some lessons and recommendations to anyone who is looking to undergo this process. So a bit about UGMC. The idea of UGMC started in 2013 and became fully operational in November 2019. It is Ghana's first quaternary level healthcare institution, meaning it handles the most complex and specialist cases that cannot be managed elsewhere. And we also aim to be a center where when we have patients come in, they do not have to be given referrals to go outside of the facility and can have all care done in the facility. We also, but to define what UGMC truly is, it's centered on the three pillars which we focus our mission on, which is the patient care, the training, and research. Our facility is not just a hospital, it is a national asset built for the future of healthcare in the country. So a bit about the facility. When you visit our center, there are 5 main buildings you are going to see. These buildings are the medical training and simulation building, which supports our training and education mission, and also the women and children building. It also have our patient tower, which is about 1,000 beds, and also the emergency and diagnostic building, as well as the outpatient and administration building. The emergency and diagnostic building houses the imaging department on the ground floor. That is where today's focus is going to be. Now, let's talk a bit about the radiology or imaging department. So the imaging department comprises of a multidisciplinary team, which includes the radiologists, the medical physicists, the radiographers, as well as sonographers and nurses and administrative staff. All of these professions come together to give holistic care when you visit our department. We can say here that all of these people came together and prepared towards hosting and responding to a full internal audit. Every single person in this department mattered in that process. Then when we come to some of the equipment in the department, we have two X-ray machines in the department, as well as an angiography, or what we call a cath lab suite. When you visit the facility, for the cath lab is usually for interventional radiology cases. Then we have a fluoroscopy machine, and then also 3 ultrasound suites in the room in the department, but then spread across the facility. We have more than 20 of them in the hospital. Then we have the MRI machine, which is a 1.5 Tesla machine, and also a 128 slice Philips CT machine. When you visit our center, you realize that most of our machines are Philips based. We also have 1 CR mammography machine, and we have a Nanox Axe, which is a very new modality. Currently, it's mainly for research and not for clinical work. And then we also have a CM, which I don't have an image here, but it's usually in the theater, or what you call the OR. Yeah. So now let's begin with the story. So what is the Diagnostic Center of Excellence? So in my pursuit to try and explain this, a Diagnostic Center of Excellence is defined by what I call the invisible scaffolding, quality management, safety culture, and continuous peer review. When equipment fail or staff change, these systems hold the department together. We define excellence through 4 dimensions from my research, and the first one being high quality imaging, patient-centered care, continuous improvement, improvement, and also strong governance. In all four, it takes all of these four things, all of these practices to have a center of excellence, which brings us to the QUADRIL audit. So just like Sarah asked, what's the QUADRIL? So for the QUADRIL, it's an acronym. And this acronym stands for the Quality Assurance Audit for Diagnostic Radiology Improvement and Learning. It's an IAEA tool from the Human Health Series number 4. The IAEA it's an IAEA comprehensive framework tool for systematically examining the medical and radiological procedures that happen in a diagnostic center. And the QUADRIL usually compares actual clinical work to the international standards. Its recommendations do not focus on the realities of its recommendations focuses on the realities of your local healthcare ecosystem and not a one-size-fits-all. So they are not stringent on just having a framework and asking us all to do exactly as it is. So the QUADRIL recognizes that excellent imaging is never the work of one profession. It sits in the intersection of 3 disciplines, which is the radiologist, the medical physicist that ensures radiation safety, the radiographer who is executing the imaging. And all of these professions come together with a focus on patient safety and quality care. So in order to achieve a center of excellence, we looked at what we currently are experiencing on our grounds. And this was what pushed us to pursue this motive. The first was being the increasing number of patients and volumes that we are getting at our facility. We needed a structured and repeatable system. And secondly, we also needed we needed to make sure that our patients are safe. We are not just giving quantity, but we are also giving quality. And in doing that, we have to make sure that our quality control measures are non-negotiable. Then thirdly, we looked at the viability. We wanted to make sure that our outcomes do not differ between procedures and between the staff and also the shifts that we run in our system. Then the fourth, we needed to make sure that our standards were at par with international standards, which all of these things coming together is what pushed us to make efforts to undergo this audit. And we come to the historic moment. So UGMC, I'm proud to say, was the first in Africa to undergo this QUADRIL audit. It's been done in other parts of the world, but in Africa, we were the first. And this was initiated by the Ghana Atomic Energy Commission in Ghana and the UGMC management, as well as UGMC imaging department staff. The audit took place in November from the 17th to 21st of 2025. We hosted the first ever African IAEA QUADRIL imaging audit, which was a very historic moment for us. And we aim to be the leading provider of imaging services within Ghana and also the sub-region. One thing that stood out to me was that the audit was not a compliance check, but a system put in place to support our practice. Now, to appreciate the significance, let's look at the QUADRIL's global trajectory. Okay, so the audit, the QUADRIL tool started in 2010 by the IAEA, and it has the potential of reaching all of its member states, which is 181 currently, and this audit process is entirely free. We did not have to pay for any of this. In June of 2025, 19 African countries were trained in Vienna for the QUADRIL audits, and we in Ghana, we're fortunate to have 3 of our colleagues go for this training, and this was to help us to prep towards the audit. And as established, Ghana was the first in Africa to be a beneficiary of this training, and we hope that the other African countries will follow this practice. So some countries that have also undergone this audit process. We have Belgium, which is the first country to make it nationally mandatory, and this has been happening since 2019. And it's also been done in Spain, where it was piloted in Barcelona and Gessa hospital groups. And also in January of 2025, Qatar had its first national level audit, where it had 16 of its Hamad medical corporate hospitals undergoing the audit simultaneously. Then in November, we had it happening in Ghana at UGMC. So now, the audit works through 3 sequential outcomes: conducting an objective peer-to-peer evaluation, where they're looking at the various professions coming together to help in improving your practice. Then system optimization to elevate your infrastructure and workflow. And then ultimately looking at patient safety, establishing that a proactive culture of radiation protection and clinical excellence, your center is audited. You cannot get to patient safety by skipping all of these two processes before. Okay, so to be clear about what the QUADRIL does and what it does not do, on the left, I tried to put together a few of what regulatory inspections would require, and also what the QUADRIL audit, vis-a-vis what the QUADRIL audit stands for. So for the regulatory inspections, they are usually punitive and enforcing, focused on strict legal compliance, governed by external regulatory body, enforce actions or penalties. But then the QUADRIL audit, what makes it stand out and makes it attractive is that it's a supportive and educational process. It is focused on clinical excellence and education. It's not focused on its focus is on excellence and continuous improvement, and the authority is peer-to-peer, comprising of international experts and not regulators. So these are people that know about the day-to-day work. They are also in the clinic with you, and so they can relate to some of these struggles that you have in the clinic. And then also the outcome actionable recommendations with no inherent obligation. It is solely to elevate your departmental standards, and it's based on your own view on whether you want to apply these or not. Now, the QUADRIL audit comes in 4 main quadrants, which is the quality management system, the patient-related procedures, the technical procedures and radiation safety, and finally, the education, training, and research quadrant, which I would like to dive in a bit more. So for the quality management and infrastructure, the auditors looked at strategic vision. Is the department aligned with the broader healthcare mission? They also looked at the quality manual. Do we document our SOPs? Are they existent? Are they relevant? The staff actually reading about these SOPs? Do they know about the quality manual? They also looked at the infrastructure and the equipment that we have in our facilities. They looked at our inventory, how proactive we are with our maintenance cycles, and then also our replacement plans in case there's any equipment failure. And also looked at our continuous improvement. Is there an active QA committee on ground? Then in our pillar 2, which is the patient-related procedures, they also looked at does it follow the procedures that we are getting? Are the imaging requests properly justified, especially for pediatric and pregnant patients? Their main focus, I realized that their main focus were on these because they are sensitive. And then also they also looked at the examination itself that we are rendering in our service, in our center. Patients being identified accurately? How are their privacy being protected? And the precise execution of imaging protocols. They also looked at the diagnostic reports that we are even giving out to these patients. What's the turnaround time? Are the reports clear? Does it effectively communicate the critical findings to the referring physician? Then finally, they looked at the continuity of care. Are we integrating, are the staff integrated into the multidisciplinary tumor boards and in clinical pathologic meetings? Are we just serving patients or just producing? Are we just serving patients or just producing images? Are we our opinion being heard in these discussions? Then in our third pillar, they looked at the technical procedures, which in this pillar, I'd say that's focused more on the medical physicist work. And this was where they looked at our comprehensive radiation protection measures put in place for safety of patients, staff, and the public, including structural shielding and controlled access. They also looked at our equipment quality control, making sure that we are balancing image quality with the lowest acceptable radiation doses, which is the ALARA principle. And also for the dosimetry, they looked at do we have our diagnostic reference levels established and the frequency at which we are having those QC images, QC equipment, so that's the Periana for our dosimetry, and also our CTDI Phantom for dosimetry as well. Okay, so then pillar 4, which is the final quadrant, we had education. We had them look at our education, training, and research. They looked at, do we have library resources? Do we have lecture facilities and the supervision structures to train the next generation? So fortunately for UGMC, we have our medical and simulation building, which I showed you earlier. And also, what is our culture for research? When you come to our facility, we have an IRB, we have our own institutional research board that's our ethical they look at our ethical compliances before even undergoing any research. So for example, they also looked at the medical physics department that we have. We currently have residents, or what we call locally as interns, coming in. They looked at the training materials. They looked at what roles these interns are playing, and making sure that we are supervising them and not leaving them to work independently. So now let's talk about the phases of the audit. So for the audit, first we had to do the application and preparation, which was done months before the visits. We voluntarily asked for the audits, as I said, based on the initiative of the Ghana Atomic Energy Commission and also our management. And then in the phase 2, we had the auditors come down to do an on-site visit where they looked at what we have on ground vis-a-vis the documentation we had submitted during our application. And then in the third phase, we received a comprehensive report that was given 6 weeks post the audit. But I think in our case, it was a bit beyond the 6 weeks because it was during the festive season as well. So there was a bit of a delay, but they aim to give you the report in 6 weeks. So the audit team that came down to our facility comprised of 1 radiologist from Egypt, 1 medical physicist from South Africa, 1 radiographer from Egypt as well, and then an audit expert who came from Greece. Now, the radiologist focused on the justification, image quality, and clinical reporting that is done in the facility. The medical physicist was looking at our QC testing, our dose audits, our quality, our image, our equipment safety, and then the radiographer was assessing examination techniques. We verifying our patients right, and what radiographic QAs do the radiographers also do before working on the patient. Then the audit expert that came with them was focused on system management, looking at our policies, our procedures, compliance, and also he was here to support the audit process for both parties, for both the auditors that had come in and also those of us on the ground if we needed any clarity. So like I said earlier, this was a peer review panel sharing their expertise to help us improve our practice based on the audit tool. Now, the 5-day visits that they came down to do, on the first day, we had our orientation and alignment where we had them do an entrance briefing. We spoke about the plan for the next couple of days and then finalized what we would do. And then we also took them on a facility tour to see what we have in the department. And then on the day 2 to day 4, then we delved into having extensive one-on-one and group interviews across all staff levels, from the radiographers to sonographers to administrative staff and all parties involved in the department. Also, they looked at they also looked at the direct observation of our clinical practice and the workflow, and looked at live image. And then on the day 5, which I found very interesting, I'll delve a bit more into the day 5, what happened. It was a very interactive exit briefing, and the day 5, they made sure that there were no surprises that we're going to see in our final report. So on this slide, I decided to put in some of the images when we had the auditors visit. We have, this was from our entrance briefing, and then this was when they came in on the first day. We had them speak to our management. Then this was during our exit. The auditors are the ones with the sashes on them, and then some of my senior colleagues in the department. Then, so like I said, so for the exit briefing, what stood out to me was that it was a collaborative discussion. The audit team presented their key findings, and recommendations were openly discussed with the entire department. They provided us the opportunity to explain and address any misunderstandings about our clinical workflow, just in case they had misunderstood anything we did whilst they were there. They gave us the opportunity to clarify it. And this was aimed at making sure that when the final report comes in, it's a shared ownership, and there's a mutual agreement that whatever their findings or recommendations are going to improve our work at the end, at the long run. So I like to speak more about some of the recommendations that they made for us when they came to visit our facility. I looked more on the medical physics recommendation. So they highlighted that there was an absence of local DRLs in the facility. So we did have one, but it wasn't spread across in the department. So now we had to put in measures to make sure that the DRLs was known to all staff, and patients dose audits and cycles were planned to happen now we have it planned and happens every quarter. Also, they looked at the staff CPD before training. Before, training was like ad hoc, but now we have a planned schedule which is aimed at achieving the main goal of the facility. And I like to also mention that the audit did not create new problems. No, it didn't. It made existing gaps visible and gave us a structured and prioritized our roadmap to close these gaps. So what did we learn at the end of the day? So some lessons. So for the lessons, some of the things that stood out to me is that quality is continuous, and cultural change in quality begins at the top. Without visible commitment from leadership, we would not have been able to achieve this. Audit drives improvement. It brought out our blind spots, and we could not see, because this was our daily practice. And they came in with the international recommendations or the standards compared to us, and then we realized that we had some gaps that we needed to fill. And to the recommendations, one of the things that helped us was that we planned ahead. We had enough time to prepare for this audit, and we were proactive and not reactive, and embraced teamwork. For us, what made our work preparation easy was that we had a lot of teamwork in this. There was no profession amongst us that was reluctant to help out with the process. Everybody was supportive of this audit process, and everyone saw it as an opportunity for the department. And in conclusion, our ambition is not just to be the first, but we aim to be the best in Africa through the ongoing commitment of every member in our department. We hope that we'll be able to achieve this aim of ours. I'd like to say a very big thank you to the Ghana Atomic Energy Commission, which was the facility that initiated this audit, the IAEA for providing us with the auditors, also to my facility management members. Thank you very much for your time and attention. I'm happy to take any questions.
Thank you very much, Mercy. I feel like I learned a lot today. Great talk, and good seeing you, RG. RG was moderating the session with me, and Afia, the president of MPWB, also has joined us today and has been helping. Thank you both. So I see 2 questions. I think I'll take those, and then I'll leave the rest for RG to take them later. The first one is from Walideen. His question is, oh goodness, where did it go? Is QUADRIL exclusive for governmental centers, or is it also available for private and PPP projects?
Okay, so from the best of my knowledge, it's not mainly for government. So far as you would put in your application and you go through your facility, you are part of the member states, they are willing to come in. Also, this audit tool is accessible to everyone through their human health series, which I mentioned earlier, human health series number 4. You see all of its requirements and everything there if you are looking to prepare for it.
Nice. Thank you. Thank you. The next question is from Marina. She's asking if you plan to have a PET CT or do you have it under another department?
So currently we do not have it, but we do have plans of starting a nuclear medicine department.
We have a question in the Q&A.
Yeah.
It says, thank you for your wonderful presentation. How in-depth were the MRI and ultrasound audits? I ask because the IAEA traditionally focuses on radiation-based modalities.
Okay, so for this particular audit, they looked at, like I mentioned earlier, they looked at the department holistically. So they did go to our MRI, they looked at what QC parameters are we putting in. One of the things that I can actually even mention that they looked out for when it came to our MRI, they looked at the privacy. That was one of the problems they asked us to work on. We had our glass were a bit clear, so they asked us to look at the frosting the area to maintain patient privacy. So I can say, based on my experience, that they looked at all modalities, regardless of whether it was ionizing or non-ionizing.
Percy, what's the financial obligation that comes along with this?
So the whole process was free. I think I mentioned this in one of my slides. Yes, the whole process was free. We did not have to pay for anything. We just had to fill in the application, but it required a lot of time, No financial obligation, but a lot of time.
Before Ajit, you move to the next question, I have a quick question. So what was like the time duration? Your institution putting up an application. Did it take like a year, 2 years? Like what was the time duration to get IAEA to come physically to, conduct the audit?
Okay, so from what I deduced from the Ghana Atomic Energy, which I stated that was the facility that initiated this whole audit, it looks like discussions to start this audit was 2 years ago. That's when they had to put in their interest in having the audits done in Ghana. And then when finally the IAEA agreed to do the audit in Ghana, then our facility came in. So starting from Atomic Energy, it was about 2 years, but starting from my facility, it took us roughly about 8 to 9 months to prepare.
Okay. Sorry, I don't want to hijack this, but I feel like I have some local knowledge and that's why I'm asking all these questions. There are a lot of hospitals, government hospitals, in the area. What made UGMC, like a special place or a place that required this audit? Does it mean the others have undergone similar audits, which it doesn't look like it because you mentioned that your institution is the first in Africa. So what warranted, UGMC to ask for this to be done?
Okay, so for UGMC, I think one of my slides, I tried to speak about that. So we were interested in undergoing this because we, first of all, which always stands out for us, we aim to always be the best in all practices that we render, and we are a facility that has a lot of special cases coming in, and so we want to make sure that we are providing the best care that we can give to our patients when they come in. And then because we already do these things, we already have an influx of people coming into our department or our hospital looking for care. So then the interest was, okay, if we are doing all of this, how are we making sure that we are rendering the best care to these individuals that are coming to our facility? Is our practice internationally acceptable? Because we don't want to just be giving them any care. We wanted to make sure that we are looking we are meeting international standards as well. So these are some of the things that we looked at when we decided that we wanted to undergo or open our doors to undergo this audit process.
So just thinking of paying it forward, is UGMC going to like provide some sort of documentation and stuff for other clinics in Africa so that they can sort of have a starting point to try and get this done?
So currently we got. So when you ask that, are you referring to in terms of are we planning to put out some publications, or
No, more like just helping out other clinics that may benefit from this, and so you can guide them. Hey, these are the people
yes,
to get in touch with. This is what you need to
yes,
do. Yeah,
yes,
thanks.
I
In
think
that
that
case,
this is something that's
audits, can't you maybe
this.
have regional or national audits and then open up for IAEA? No?
Sorry.
Perhaps you can start with like regional audits or national audits, right? And then prepare them this way for the IAEA audits.
True.
Okay. Yeah. So I think that these are very good suggestions to us. Thank you very much. Currently, like I keep emphasizing, we feel very fortunate to have been the first to undergo this. And I think that even taking this initiative of doing this presentation is a way of putting ourselves out there and letting people know that we have undergone this practice. And so if you need the help, you can always come to us. Our doors are open. I'm one of the people that you can reach out to. I can provide my contact. You can reach out to me if you are looking to prepare for the audit. I'm very sure my team, my department would be willing to also provide you with any support that you give. But then also note that the IAEA also provides training for this. Prior to us having this audit, they also did like the training for the facility for 19 African countries. So this is knowledge that everyone is accessible to.
Another question, based on your audit results, what changes were made to your workflows or tolerance values?
I think Paris is frozen, but
Yeah.
it's funny because I was waiting to ask this question. This question, the question that Afia asked too. So I'm happy you got.
Sorry, my line went dead for a minute there.
No. Based on your audit results, what changes were made to your workflows or tolerance values?
Okay, so I think this slide actually talks about that question. So before, we didn't have systematic records of those tracking, and currently we've put in like a system where we do those audits every quarter, and we also didn't have like a QC. We didn't have it formalized. Now we do have it. We have a plan in where we even have put in measures where the senior medical physicist would have to sign off on the logs that are put in place. And our CPD, like just like in my last slide, we have the training. So currently, I'm even sitting in our conference room at the moment. So we have a room where we have our monthly or weekly meetings. Before, we didn't have it structured or looking or focusing on a particular team. It was ad hoc. But now, based on their recommendations and our understanding of what they provided for us, now we have our CPD or our trainings focused on a particular team, which feeds to the main hospital's vision and mission. So these are some of the changes that we have put in place after the audit.
That's awesome.
I mean, there's more. The recommendations they gave us were about 98 pages long. I just tried to summarize them. Yes, but what made me most happy was that majority of the recommendations they made were just to improve what we already have. So we have the baseline, but they were looking at how do we meet the international standards. It was not mainly about what we lack, but how to improve on what we already have. Yes.
Yeah, I think that's all the questions we have. This actually was a really good talk. I only learned about this not too long ago through Gada. She's also one of the board members of MPWB, so this definitely helps. Thank you so much, Mercy, for taking time out from, I know it's a busy schedule and time difference. Appreciate that.
Yeah, thank you. I do have a follow-up on this question before I share my screen. So all the changes that you made were like on the managerial end, right? Like nothing on tightening, for example, I don't know, tolerances or adjusting protocols for imaging modalities and whatnot, right?
Sorry, the line went dead again. Please, can you come again, Sarah?
Oh, no worries, no worries. I was saying it looks like the main changes are on the managerial end, right? Like about documentation and whatnot. Not much changes with imaging protocols or doses or exposure limits, like that, right?
No. So yeah, majority of the things were on the infrastructure and also like how to improve your practice, but not on the imaging protocols as well. No. And then one other thing about this audit is that the recommendations are sent directly to your management. It's not something that is put out there, so you don't feel like you are being judged or put out there for everybody to look into your business. Yes.
Gotcha. That's interesting. Okay. I agree with Arjit. We thank you. We thank you very much for the very insightful talk, Mercy. It's a great talk, and I've learned a lot from you and your leadership. All of us would like to thank Mercy Torshie Schandorf for today's talk, the AAPM headquarters in Lisa for facilitating this and help us running it, for the MPW board, including, of course, our president, Afia, and the participants, everyone that's here today. For those who asked about where to find the talk, you can scan this QR code. It will take you to the YouTube channel where we have previous talks also. If you can't find it, just go to MPWB on YouTube and you should find all the previous talks also. And we will post this one probably in a couple of weeks. And that's it. If you're not a member yet of MPWB, we encourage you to be members. Follow us on social media, and looking forward to the next webinar, hopefully soon. Thank you, everyone, and have a wonderful day or evening, depending on your time zone. Bye.
Thank you.
Thank you, Mercy.
You're welcome.